thank you everyone for coming this afternoon to join us. So my name is Vicky McGurk and I'm the counselling lead for Crossroads ReferKent. Thank you for taking the time out of your busy day to join me. So today I will be talking to you about our award-winning counselling service for unpaid family carers and how you can access it. But firstly, I'd like to talk to you about Crossroads, our wonderful charity, and to run through what we offer for those of you that don't know. The counselling provision is only a small part of what we offer. Crossroads has been described as Kent's biggest kept secret. We're looking to change this and shout from the rooftops to raise awareness about the invaluable service that we offer to unpaid family carers. So did you know that 1 person in 9 is an unpaid family carer? 3 out of 5 of us will become a carer at some point. 600 people leave their jobs every day to care. 40% of carers who receive carers allowance are in debt. And 1/3 of carers say that their mental health is bad or very bad. Carers UK, a charity that supports carers across the UK, states that the vast majority of care in the UK is delivered by family and friends. Many have become sandwich carers, and that without the provision of care, social services and the NHS would collapse. The care given by the nation's unpaid carers is worth an estimated £132 billion per year. That's, excuse me, that's considerably more than the total spending on the NHS in England. So, individuals who have a dual caring role are tasked with the responsibility of care of both their own children and an elderly relative who may be suffering from illness, disability, or a life-limiting condition. They will be juggling responsibilities and navigating the demands associated with multiple roles, which contribute to both physical and emotional fatigue. Sandwich carers frequently experience financial strain, with various studies indicating that they are more likely to report difficulties in managing their finances. The stress associated with their caregiving role can lead to heightened symptoms of mental health issues, including anxiety and depression. They often encounter challenges on achieving a work-life balance as they strive to reconcile their caregiving duties with their professional commitments and personal lives. So 1 in 5 working adults are also juggling carer responsibilities, so the demand for support has never been so high. So having a place to offload some of the pressure is invaluable. So at Crossroads ReferKent, our aim is to look after the carer. The person with their care needs will automatically be looked after, but the carer's needs aren't taken into account. They are left to manage their situation that they didn't ask to be in and navigate it the best they can. Crossroads aim to support that person to make their caring role a little easier and to feel that they have the support they need to prevent them from reaching a burnout situation. So here's what we can provide for a carer to lift their load and feel supported at Crossroads ReferKent. So we offer regular short breaks for family carers with any condition via a care support worker. So this is a 3 hours respite per week for at least 6 months. So this would mean that a care support worker would come into the home of the family and sit with the cared for, and the carer can then either go out and do something for themselves, or maybe go and get their hair done, or catch up with some friends for coffee. So that's an invaluable break that they can get there. We offer hospital discharge. This offers short-term support for family carers who may have difficulty in coping with their loved one's initial care needs after returning from hospital. We have health appointment replacement care. So this is a free service that encourages carers to address their own health needs without worrying about the person they care for. So carers can use this time to attend their own medical appointments and treatment, knowing that their loved one is safe. and then they can concentrate on their own appointment without having to worry what the person is up to. We offer urgent care. Urgent care, this offers rapid response to prevent the breakdown of care in situation that might lead to hospital or care home admission. This service aims to reduce disruption and distress by providing high quality care during a crisis situation of emergency. We also have a young carers project. So this provides crucial support to individuals under 18 who care for family members facing disabilities, illnesses, mental health conditions, or substance abuse challenges. And what this does is it gives our young people the chance to go and be young people with other young people, rather than worrying about the role that they have at home. So it gives them a break. We also provide clubs, offering a range of clubs providing carers with much needed respite. So what this does is the carer drops the cared for at a club, and it's normally for about 5 hours, so that the person knows that they're cared for is safe, and in a safe environment, and then that gives them a chance to go off and have a well-needed break. We also have Macmillan Crossroads volunteer service. This offers 12 weeks of support for people living with cancer, providing companionship, transport to hospital, doctor's appointments and help and support to those people. And then we have the carers counselling, which is up to 12 weeks free for adult carers. So during a routine check-in and chat call to one of our carers, she disclosed that she had a hospital appointment to investigate a shadow detected on her liver. She broke down while she was on the phone to us and told us that she didn't think she'd be able to make the appointment as she had no one to sit with her mum, whom she cared for. She couldn't get there anyway as she didn't drive and had no one to take her. She said she felt like no one cared about her, people only cared about her mum. So the teams at Crossroads all got together, and we were able to provide transport to the hospital and back whilst providing a care support worker to sit with her mum so that she could attend this appointment. Thankfully, all was okay. But through using our service, she was able to get the reassurance that she needed, knowing that her mum was okay. She reported that she had felt heard and supported, and that this had lifted her spirits, along with a massive relief of knowing that all was okay with her own health. So referrals to Crossroads can be made by telephone, by calling our main number and going through to option 1, by email, by referrals@crossroadskent.org, and via our website at www.crossroadskent.org. And there's a page there where you can fill out a referral form, and then that will get picked up by the team. So when Crossroads receive a referral, it's triaged by our gateway team. This means that one of our lovely ladies on the team will do a holistic assessment of the carer's needs and make sure the appropriate referrals are made to the services required. At this time, they may signpost to other organisations that they feel may also benefit the carer. At this point, they will also be offered the opportunity to access our counselling service. So now to the part that I am the most passionate about, the counselling service that offers the carers the chance to talk about their own feelings. So most carers have been thrown into this situation unprepared. Some may feel angry about this, and then they might feel angry about having those thoughts or feelings. They may have had retirement plans with their loved one, which they simply cannot fulfil. Not to mention the change of dynamics in their relationship. They may have lost their partner and as they know them, and be dealing with the anticipation of the loss that is to come. So I'm sure you will agree there's a lot going on. Most feel unable to talk to family members about this as they don't want to burden them. It's just what you do, right? It's an expectation that you will just get on with it. Talking to somebody independent who has no emotional ties can be extremely beneficial. You're not going to hurt anyone's feelings by being honest about what's going on for you, and nor will you be judged. So who delivers our counselling? So our counselling is delivered by supported trainee counsellors on placement. These trainees will be on their second year of their level 4 diploma training, having completed levels 2 and 3 already. It's the final part of their training to conduct 100 hours of counselling in a supported placement. This is part of their qualification. They can't qualify without having this carried out. Our counselling placement is made up of 3 qualified counsellors who mentor our trainees throughout their placement. That's myself and 2 other colleagues. We've all done we're all qualified counsellors, so we've been through our training. We know what level 2, year 2 of level 4 is like. It goes in a bit of a blur. There's so much going on, but we all understand the stresses that brings. So we all mentor the trainees across the whole of Kent. 10 years ago, we started off with 1 trainee counsellor who Crossroads had supported her family and who wanted to give something back once the service had ended for her, once her loved one had sadly passed away. The service has evolved between now and then, and we have supported 66 counsellors in training through their placement to gain their qualification. We've taken on a further 30 trainees for this year's intake. So by the end of this year, we will have supported just shy of 100 trainees on placement. In the last year, we provided just under 3,000 counselling sessions free of charge to carers. So how do we know it's safe for a trainee to deliver sessions? So at Crossroads Care Kent, we fully support our trainees through their placement, making sure that they are compliant and working ethically, ensuring the safety of our clients. Before they can begin their placement, they will need to have been signed off as fit to practice by their college. They must succeed at a rigorous interview demonstrating their suitability and commitment to our organisation. They will have been through our compliance checks, be fully insured and a member of an ethical body such as the BACP. Once they are on their placement, they will attend regular meetings with their mentor and attend independent supervision to ensure that they are working safely and ethically. So what do clients get so they will get up to 12 sessions of free of charge. So some may need all 12 sessions and some may need just a few to help them process where they are and what they may need to do for themselves to make things better. Some, on occasions, some may have an extra couple of sessions if they haven't quite got to where they need to be, but that's up for discussion. But generally, we would end them at 12. But like I said, some people only need a few for them to actually understand where they are and what they need to do to make things better. We do not give advice, but we help our clients to come to their own decision about what is best for them in their current situation. We enable the client to see things from a different perspective and explore options that are open to them to see how it might feel. So within that, they may learn new strategies to help and support them in their caring role. All sessions are held in a safe space and are totally confidential. So what are the benefits from counselling? So talking to someone you don't know can take away any barriers about what you should or shouldn't say. For instance, if you said to a family or a friend or a family member, I don't really know what to do, they would invariably say, well, what I would do is, or what you should do is, so counselling gives the carer the opportunity to explore what's right for them, not for other people. So what is right for one person may not be right for another. And the confidential space gives the client the autonomy to make decisions that feel right for them. They will not be judged, whatever they may say, but given the space and the compassion to explore how they are feeling. Our sessions can be delivered face-to-face, remotely over Zoom or Teams or over the phone, because we recognise in this organisation that carers cannot always get out, and they have busy lives with appointments and different things in their caring role. So if they can't get out, we can deliver we can tailor the delivery of their sessions to meet their needs. So we currently have, excuse me, we currently have 8 locations across Kent to be able to provide face-to-face sessions, 2 provided by Age UK, 4 provided by care homes across the region, and we have 2 of our own sites. We're always on the lookout for more locations, so if anyone has a spare room that's not being used and would be interested in offering it to widen the provision and the accessibility of this service, please do let me know. So who can access our service? So anybody who's over 18 and caring for an adult can access our counselling service. And what might a carer bring to a counselling session? So although a carer can bring anything they choose to their counselling session, here are some of the things that the clients bring. Family and personal relationships, because when you're thrown into a carer role, sometimes that could put pressure on your relationships with your siblings or people that aren't what you might deem to be pulling their weight. So personal relationships can suffer. Work issues, their loss and their anticipated grief, because all the time they're going through that loss of the person, they're also anticipating the grief that is to come. So being able to understand that and work on that can sometimes be helpful. Financial burdens, childhood issues that may impact on their caring role, asking for help and self-care. And we can help carers work on their boundaries, which can empower them in their role. Self-care. So it is natural for a carer to neglect their own self-care when caring for somebody else. We try and encourage the carer to put on their own oxygen mask first. It is enough to be a good enough carer whilst also taking your own needs into account. So often a carer thinks that they must do a perfect job in caring for their loved one, but this brings a crazy amount of pressure, trying to get everything right all of the time. There is a concept by Donald Winnicott around the good enough mother, in which a mother adapts almost completely to her infant's needs and then gradually fails to meet them in a small, manageable ways. This imperfect but sufficient parenting helps a child develop a sense of external reality separate from themselves, fostering independence and coping skills rather than being hindered by the frustration of being perfect. A good enough mother isn't perfect. She balances meeting the needs of the baby with her own needs. Winnicott argued that a good enough mother does not need to be a perfect, selfless entity. She just needs to be good enough. This concept can be adapted to carers. You do not have to be a perfect carer. Good enough is enough. And whilst maintaining your own self-care alongside your caring role, this is more likely to provide a better quality of care. So who is a service not suitable for? So unfortunately, we cannot take anyone who's under 18, anyone who is feeling suicidal or having intrusive thoughts, and anyone with complex mental health diagnosis. Our service is for low-level mental health difficulties that are within the competency of a counsellor in training. We do have some qualified counsellors that have stayed with us since they finished their placement, and sometimes we are able to accommodate some complex needs, but generally we try and keep them low level so that they fall into the competency of a trainee. So anyone experiencing difficulties outside of this should seek medical advice and the correct referral for mental health support. So where can I signpost those in crisis? So we cannot support those in immediate crisis. So here are some organisations that you can signpost clients to that might be able to help in these situations. So we've got the Samaritans that you can call or text, and they're open 24 hours a day, 7 days a week. There's Mental Health Matters, Safe Haven. They have sites across Kent and a helpline. And they're open to drop in from 6 p.m. to 11 p.m. every day, but it's actually every night. Shouts, you can text them. They're open 24 hours a day, 7 days a week. And Calm, you can call them. They're open in the evenings from 5 p.m. to midnight, 365 days a year. So how much does our counselling cost? So sessions are free to anybody who is an adult carer caring for an adult. In the current climate, 12 sessions of counselling can cost around £600. So we offer 12 sessions free of charge to assist in the caring role and to try and prevent carers reaching a crisis mental health situation. So anyone who meets our criteria can refer themselves. They do not have to be referred by a healthcare professional. But I know there's a lot of people out there in different organisations. So if you come across somebody who is a carer and is struggling, then please point them in our direction. And this can be done by on the phone, on our normal number. Option 5 will bring you through to the counselling department. By email, counselling@crossroadskent.org. Via our website, www.crossroadskent.org, and there's a referral form on there that people can self-refer, or a referral form which I'm happy to supply to anybody who would like one, if you want to have one on file, which you can then just send through to our counselling email. So what do our clients say about us? This is a picture of some of our trainees. So one client said, I feel more confident in myself and I have more respect for myself. I think my mental health was really suffering. Another one said, being a full-time carer is lonely and isolating. Being able to talk to someone really helped me get through things. And then someone else said that this service is so valuable. My life has changed overnight. My life changed overnight when I became a carer. Talking helped me to manage my thoughts and feelings. And this is my direct contact for anyone who wants to get in touch. I'm happy to make direct connections, so please feel free to get in touch if you want to. And that's me. Thank you for joining me and listening this afternoon.
That has been really, really interesting. Thank you for your time. And for the such a clear presentation. It's really helpful. You're talking about making referrals. You can of course make referrals through ReferKent.
Okay.
So that's another option for someone who wants to make a referral to your service.
Thank you. Okay.
Okay, well, I think we're done. So thank you very much for coming along.
Thank you.
Okay, nice to see you all, and hopefully see you again all soon. Okay, bye.
Thank you.